Imagine feeling completely overwhelmed, isolated, and unsure of how to navigate one of the most transformative periods of your life, parenthood. Now imagine realizing that you're not alone in this struggle, and there are safe spaces where you can find support, understanding, and healing. That's exactly what some organizations in Baltimore are striving to provide for parents who are grappling with declining mental health after welcoming a new child into their lives. Parenthood is often romanticized as a time of joy and fulfillment, but the reality is far more complex. For many moms and dads, the first year of their child's life can bring feelings of sadness, guilt, and anxiety. One place where parents can connect with others going through similar experiences is Afterglow, a therapy group designed for individuals dealing with postpartum depression and anxiety. Hosted by the Womb Room near Hampton and led by licensed therapists like Claire D'Onofrio, a clinical social worker and perinatal psychotherapist, this group provides a space for parents to unpack their birthing stories, discuss postpartum symptoms, and explore ways their partners can offer meaningful support. D'Onofrio explains that many participants come to the group burdened by feelings of isolation, excessive worry, and difficulty relaxing as they obsess over their baby's developmental milestones. Group therapy allows these parents to feel validated and less alone. It also empowers them to share practical strategies they've discovered along the way. Being able to help others boosts self-esteem and reinforces your sense of identity, she says. It creates a sense of belonging within a supportive community. But here's where it gets concerning. A recent nationwide study reveals alarming declines in mothers' self-reported mental health. Experts in Baltimore echo these findings, noting that between 2016 and 2023, the percentage of mothers reporting excellent mental health plummeted by nearly 13 points. Meanwhile, those describing their mental health as poor or fair increased by 3.5 percentage points. To put it into perspective, in 2016, about 1 in 20 mothers rated their mental health as poor or fair. By 2023, that figure had risen to 1 in 12. And this is the part most people miss. While mothers tend to report poorer mental health than fathers, the decline in well-being was comparable for both parents during this period. Colleen McCallum-Bridges, an author of the study and a maternal health researcher, notes that several factors likely contributed to this trend. These include rising economic instability, shifting societal attitudes toward issues like climate change and systemic racism, and growing feelings of social isolation. Single parents and those with children on Medicaid or without insurance were hit hardest, highlighting deep inequities in access to care and resources. Kesha Baptiste Roberts, a seasoned expert in maternal and family health, emphasizes the logistical challenges parents face when seeking help. Finding time for therapy, securing childcare, and arranging transportation can all seem insurmountable when you're already stretched thin. She points out that the emotional toll tends to peak during the first year of parenting. Older adults may experience a range of physical and cognitive changes as they age, which can impact their daily lives and overall well-being. Some common challenges include decreased mobility, chronic health conditions, memory lapses, and sensory impairments such as vision or hearing loss. These changes often require adjustments in lifestyle, including modifications at home to ensure safety, reliance on assistive devices, or increased dependence on caregivers. However, it's important to recognize that aging is a highly individualized process. What one person experiences may differ significantly from another. To maintain quality of life, older adults are encouraged to adopt proactive measures. Regular exercise tailored to their abilities can improve strength, flexibility, and balance, reducing the risk of falls and promoting independence. Nutrition also plays a critical role. Diets rich in fruits, vegetables, lean proteins, and whole grains can help manage weight and prevent chronic illnesses. Staying socially engaged is equally vital, as loneliness and isolation have been linked to negative health outcomes. Participating in community activities, volunteering, or joining clubs can foster connections and a sense of purpose. Cognitive health is another area of focus, with activities like puzzles, reading, learning new skills, or engaging in creative hobbies shown to stimulate brain function. Routine medical checkups are essential to monitor and address any emerging health concerns promptly. Additionally, mental health should not be overlooked. Counseling or support groups can provide valuable outlets for processing emotions related to aging, grief, or life transitions. Despite these challenges, many older adults lead fulfilling lives by embracing adaptive strategies and focusing on what remains possible rather than dwelling on limitations. Advances in healthcare and technology continue to enhance opportunities for active aging, enabling individuals to thrive well into their later years. By prioritizing wellness and staying connected to their communities, seniors can navigate the complexities of aging while maintaining dignity and joy.